Welcome to this video of the anterior segment in which you will see an area of redness which is present in the temporal part of the sclera in this patient. The important thing to look at when you see a temporal redness is this elevated? Does it look elevated? So if I see it looks like this, it seems to be slightly elevated. And what type of blood vessels are you seeing? Are you seeing any deeper blood vessels or just superficial blood vessels? So obviously there seems to be deeper vessels involved in this. The next thing is, if you touch this, is it painful or not? This patient had a painful or a tender area when you touch this lesion. So in order to differentiate between scleritis and episcleritis, the next thing you would do is put a phenylephrine drop in, and if there is obliteration of that redness, then that's most probably episcleritis. But if it remains the same, it is scleritis, or it just tends to get slightly less. There is no anterior segment involvement, as the anterior segment seems to be pretty quiet. But what I wanted to see is, was it a nodular or a plain diffuse scleritis? And this seems to be a nodular scleritis, seems to be an elevated area. And the next thing you want to see is it as a necrotizing scleritis or a non-necrotizing scleritis. If you want, doesn't seem to be any necrosis at the top, and then you go on to a higher slit beam and then make a slit, and that is actually going to tell you that this is something which is raised. Here you can see there is some elevation of raise or elevation in this area compared to if it was just you'll see as the slit moves forward, it tends to become flatter, and this is the nodule which is sort of pointing out in the central area. So this is the actual point in this, and let's go forward on this. So this is scleritis, and actually you can make the thin beam, and now when I'm going through you can actually see the thickness of the sclera in that area. So that tells you that this is scleritis and not episcleritis, and this is a nodular type of episcleritis which is non-necrotizing and which is not involving the anterior segment along with it. The treatment of this would be to give non-steroidal anti-inflammatory orally and systemically, and then you would also give topical steroids and then do systemic investigation to find rheumatoid arthritis, RA factor, or any other autoimmune disease such as vagus granulomatous or SLE. Thank you very much for watching.